Okay, welcome to today's Kennedy webinar, To Wheat or Not to Wheat. My name is Andrea Caplan. I'm a registered dietitian and certified diabetes educator with Kennedy's Nutrition Wellness Center. So today we're discussing the trend in gluten-free diets. Nearly 1 in 3 U.S. adults are trying to reduce or avoid gluten in their diets. However, the number that actually need to do so for medical reasons is far fewer than that. So what is this trend related to? A lot of popular diets out there are claiming that gluten-free is a cure-all or a diet for treating obesity and illness. So is that really the case? That's what we're going to be discussing today. So first off, talking about what exactly is gluten and having some background on that. Specifically, gluten is a protein that's formed by the interaction of the molecules gliadin and glutenin. It's found in wheat, rye, and barley. Those are the 3 primary grains that contain gluten. So gluten is actually what gives baked goods and bread specifically, their texture, the chewy texture of bread, gluten is responsible for that. And the gluten is what traps the carbon dioxide in those baked goods and adds volume to them. So for anybody that's had gluten-free breads or baked goods, you've probably noticed that the texture of them is much denser and heavier because they lack gluten. They don't have that same capability of trapping the air that gluten-containing products do. So where is gluten found? Wheat is the primary source of gluten in the U.S. food supply. Our popular staples in the diets of most Americans, like breads, pasta, cereals, crackers, and baked goods, all contain gluten, specifically usually from wheat. Other gluten-containing foods are other versions of wheat, like couscous, bulgur, farina, and farro are all other versions of wheat. Beer contains gluten. Anything with malt or malted foods like malt vinegar, malted milk, and malt extract are gluten sources. And then a lot of processed foods tend to have gluten in them, like sauces and gravies that are thickened with flour, processed lunch meats, soups, salad dressings, and candy, just to name a few. So why would somebody go gluten-free? Typically, the most common reason is for celiac disease, which is an autoimmune disorder where any ingestion of gluten damages the lining of the small intestine. So the only way to control that and prevent the intestinal damage is to adopt a gluten-free diet. That's the only treatment for celiac disease. So as far as diagnosis of celiac disease, symptoms of that can vary. Actually, only about 1/3 of people with true celiac disease actually experience GI symptoms like bloating or diarrhea. Other symptoms of celiac disease are anemia, fatigue, joint pain, osteoporosis, depression, migraines, and infertility are actually all symptoms of celiac disease. So true celiac disease only affects about 1% of the population. So like I said at the beginning, the number that are actually trying to avoid or reduce gluten in their diets is a lot higher than those that actually medically need to. As you can see here, only about 1% have celiac disease. So we just had a question pop up. Are gluten and carbohydrates the same? So gluten is actually a protein component of grains. So it's found in foods with carbohydrates, but it's not actually the carbohydrate component of the carbohydrate. It's the protein component. So it's slightly different. And then, so another reason to go gluten-free, if you have been tested for celiac disease and that was ruled out, you don't have celiac disease, but those symptoms that you might have been experiencing that I just discussed on the previous slide might still improve from eating gluten-free, then you're likely in the category of what's considered non-celiac gluten sensitivity. So the exact prevalence of how many people have that diagnosis isn't clear because often it's self-diagnosed, but anywhere from 0.5 to 6% of the population is estimated to have non-celiac gluten sensitivity. So there's not exact testing for that. But a elimination diet is typically what is used to rule out or diagnose the non-celiac gluten sensitivity. So if you don't have celiac disease or gluten sensitivity, should you still eat gluten-free? That's something we'll discuss further along as far as benefits. There might be other diets that would be more appropriate for you, or if you have other symptoms, digestive related, there's another diet called a low FODMAP diet, which I'll talk a little bit about at the end, that actually might be more beneficial for your GI symptoms than a gluten-free diet. So gluten-free is not exactly for everybody. If you don't have the celiac disease or the non-celiac gluten sensitivity, it's a very hard diet to maintain to totally avoid gluten, not only those common foods that contain gluten, but the strict nature of making sure that you avoid any cross-contamination, especially if you do have celiac disease. That's very important because even the smallest particle of food from like a toaster that's been used to prepare gluten-containing bread and for somebody that's gluten-free can be enough to trigger symptoms and do that damage to the small intestine. So cross-contamination is a very serious concern if you're maintaining a gluten-free diet. Not to mention gluten-free substitutes are often much more expensive than the gluten-containing counterparts, so for budget reasons it can be hard for someone to maintain a gluten-free diet. The taste is often not comparable. Like we said, gluten is an important part of the structure for a lot of baked goods, so the taste is often different to get used to for the gluten-free products. And nutritionally, gluten-free products can sometimes be lacking in some important nutrients because of the different ingredients that are used. And lastly, gluten-free, although a lot of reports in the media or what you may have heard from celebrities who follow gluten-free diet is not a guaranteed way to lose unwanted pounds. So that brings us to the next slide here with a couple gluten-free diet myths that we want to dispel. So a gluten-free diet is good for weight loss. In fact, that's not totally true. A lot depends on, how you specifically adopt a gluten-free diet. If your intention is weight loss and you remove all gluten-containing foods, then you may lose weight just due to the fact that it tends to be a lower calorie diet if you're eating naturally gluten-free foods like fruits and vegetables and lean proteins and low-fat dairy products. But if you're substituting gluten-free processed foods for the regular gluten-containing versions, then it's likely to be actually a higher calorie diet due to the gluten-free products being often higher in fat or sugar. So the gluten-free is not an automatic weight loss guarantee. And then another myth out there is that going gluten-free will cure most modern-day illnesses. In fact, obesity, diabetes, heart disease, those are all attributed to a variety of factors, and just singling out one specific food or food type like gluten is not an easy answer. There's a lot more to it than that. So gluten-free, just because a food is labeled that way doesn't mean that it's automatically healthier. Often it's lower in fiber because gluten-free grains tend to be refined and lacking in fiber, not whole grain. So a low fiber diet, like the gluten-free diet, can often may result in constipation, other gut issues, and actually a higher risk of GI cancers. And then typically the gluten-free products can be lacking in B vitamins, folate, and iron because they aren't often enriched or fortified the same way that wheat and other grains are. And then they're often higher in fat, sugar, and overall calories, since those added nutrients are used for making up the flavor that's missing without the gluten. And they tend to be higher on the glycemic index, meaning that they're more rapidly digested and likely to spike the blood sugar after eating. So if you are following a gluten-free diet, because the fiber is an essential component to a healthy diet, paying extra special attention to that and making sure that you're including foods that be good sources of fiber. Even without eating gluten-free, just the standard average American diet, most of us tend to be lacking in the fiber anyways. And then, like we just discussed, even with the gluten-free diet, it can be even harder to get the fiber in. So the goal is at least 25 grams per day, upwards of 38 grams per day for some individuals is needed. And it's important for digestive health. Preventing constipation, diverticular disease, and colon cancer, as well as for weight management and heart health. So, question about cereal being a good source of fiber, and if it's too processed to be healthy. So, a lot depends on the brand. There are some good cereals that are good sources of fiber. And some of them they add fiber to, which for some individuals that added fiber isn't necessarily as helpful and may cause more harm than good with digestive issues. So naturally good sources of fiber for cereals, plain like unshredded or plain unsweetened shredded wheat. If you're not trying to go gluten-free would be a high fiber option. Cheerios are now gluten-free and have a fair amount of fiber, about 3 grams of fiber per serving, which is typically considered the minimum to look for if you're looking to increase fiber in the diet. So that would be an alternative if you are trying to go gluten-free. And oatmeal is a good source of fiber, but something for somebody that would be eating gluten-free, you would have to specifically look for those that are certified gluten-free because oats are often contaminated. They don't contain gluten themselves, but they're often subject to the cross-contamination issue if you're trying to eat gluten-free. So rye bread versus whole wheat bread, there's a question on that being healthier. The rye bread often can be refined and lacking in the fiber, so that's not necessarily a healthier alternative to the whole wheat. If you specifically seek out versions that are made with whole rye flour by reading the ingredient list, anytime you're looking at the package, reading the ingredient list and looking for the word whole as the first word on the ingredient list is a good strategy to verify that it is actually a whole grain versus if you saw it refined or enriched, that means that it's processed and has the fiber and a lot of the vitamins and nutrients removed. And then as it relates to the gluten-free diet, rye also contains gluten, so it's not any better in that regard. If you are trying to eat gluten-free, it would still be an issue with that, just like the wheat. And then outside of the cereals that we were discussing for being a source of fiber, some gluten-free high-fiber foods to include to ensure that you're meeting the goal of at least 25 grams of fiber per day beans would be a good option. A serving for beans is a half a cup, and most of the beans, like kidney beans or black beans or chickpeas, contain upwards of 8 grams of fiber for that serving size. So that goes a long way to helping to meet the minimum goal of 25 grams of fiber per day. Brown or wild rice are gluten-free and whole grain options that would provide more fiber, or quinoa, nuts and seeds, and all your fruits and vegetables are good sources of fiber and naturally gluten-free. So for somebody that's not been used to eating a lot of fiber, it's best to go slow with incorporating those things in, just so as to avoid any additional symptoms of gas or bloating or abdominal discomfort as your digestive system adjusts to the higher fiber diet. So should you be eating gluten-free? If you suspect that you may have celiac disease, if you suffer from any of those symptoms that I mentioned, whether they be the GI symptoms or the migraines or depression or infertility that you haven't received any other explanation for, then it's best that you get tested first before you go gluten-free. If you're already eating a gluten-free diet, the testing for celiac disease is actually not accurate. You need to be eating gluten before you get tested, or at the time that you are tested, in order for you to get an accurate result. So testing usually involves a blood test as well as a biopsy of your intestines to get the most accurate diagnosis. And then, like we said, if you're tested and that's ruled out, but you still feel better eating a gluten-free diet, then most likely you would be in that category of the non-celiac gluten sensitivity. So again, there's no specific test for that. It's just a matter of the elimination diet and if you respond to that. And then I mentioned earlier, other digestive issues may respond actually to what's called a low FODMAP diet. So that's typically what's recommended for IBS, irritable bowel syndrome. That actually addresses the carbohydrates in the diet that aren't completely digested. There's carbohydrates that our body doesn't completely break down, so then when it moves along further in the digestive tract, our good bacteria that are in our digestive tract feed off of that and ferment those carbohydrates, and that is what can often be responsible for GI symptoms like gas, bloating, diarrhea, constipation. So certain fruits and vegetables, grains, often the grains that contain the gluten, like the wheat and the rye and the barley, are high in certain types of FODMAPs. So it might not be the gluten that you're sensitive to. It could actually be the FODMAPs that are in those same grains that could be causing some of your digestive symptoms, as well as legumes and dairy are also other potential sources of FODMAP. So other than following a gluten-free diet, for general healthy digestive systems, some good tips here: feeding the good bacteria in our digestive system, known as your microbiome. That includes eating foods that are prebiotics. That means that they promote foods that promote the growth of those good bacteria in your gut. So some examples of those would be onions, garlic, asparagus, artichokes, bananas, soybeans, and whole wheat foods. And then by including probiotics from the foods that we eat, so foods that are sources of those good bacteria, like yogurt with live and active cultures, and then other fermented foods like kombucha, sauerkraut, tempeh, and miso are all also sources of probiotics that can be included in the diet. And then reducing inflammation. Some foods specifically that are anti-inflammatory include oily or fatty fish like salmon or tuna. Walnuts are a source of omega-3s and olive oil from plants versus the fish being the omega-3s. Leafy green vegetables, tomatoes, and blueberries are some produce specifically that are high in antioxidants that can help reduce inflammation. And then we talked a lot about the fiber, increasing the overall fiber intake in the diet from the whole grains, beans, fruits and vegetables, and then just maintaining an overall healthy lifestyle, plus alcohol intake, not smoking, and exercise are all important components for that. So some additional resources that are available regarding the gluten-free diet. The celiac organizations, the Academy of Nutrition and Dietetics is always a good resource for all nutrition-related questions. The IDS and FODMAP diet, there's a dietitian that specializes in that. And then Kennedy has their department that I'm a part of, the Kennedy Nutrition Wellness Center, where we're a team of registered dietitians that deal with all sorts of health issues, including digestive issues that could respond to specialized diets. So if you're not sure as to what might be going on or what diet is best for you, reaching out to one of us to set up an appointment at the number that you see here is always a good strategy. Thanks so much for your time. If there's any additional questions, I'd be happy to answer those now. So can yogurt with stevia cause stomach upset is the question. It certainly can. Yogurt, although it does have the good probiotics for some people, if you're sensitive to the lactose, which is one of those types of FODMAPs that I mentioned, it's not as high in lactose as some other foods, but if you are super sensitive to lactose, it could be that. Stevia doesn't typically cause digestive upset the same way that some of the other artificial sweeteners do, but everybody's different with how their system handles things. So it certainly could be that. It could be other components to it. It's got fruit in there. Like I said, some of the fruits are higher in fructose, and that can be one of the FODMAPs that people are sensitive to. So it really depends on the individual and kind of testing out what they do best with. And again, usually the FODMAPs, just like the non-celiac gluten sensitivity, usually is determined by a elimination diet, usually under the guidance of a registered dietitian. Another question, do you believe that avoiding gluten as a child can lead to health problems in the future? So kind of how avoiding peanut products can cultivate peanut allergy in children. I think certainly if it's something that isn't medically necessary, if they're adopting a gluten-free diet just because maybe that's how their parents eat and that's how they have been brought up, that could definitely lead to issues, like we said, with the digestive system not possibly getting enough fiber in, and the problems that can lead to in terms of the constipation or diverticular disease or the increased risk for cancers, certainly could be the case. Thank you so much for your time and for listening to Kennedy's webinar today on gluten-free diets and to eat or not to eat.